So in today's talk, I want us to talk about family planning. Family planning is birth spacing. Family planning is using methods that can enable you prevent pregnancy or plan for pregnancies adequately, right? So we have different methods of family planning. I'm going to categorize them according to their efficiency. So I'll start just a general categorization of family planning methods. So what we call the tier system. The tier system is a classification based on efficiency. Then after that, we'll get right into the different methods of family planning. So the first tier is classification based on efficiency. The first tier, these are very efficient methods. They have a less than 2% failure rate, and this include things like the copper T. We know copper T, IUCD, right? Intrauterine copper device. Other intrauterine devices such as the Mirena, and then implants, what the common mwananchi will wrongly refer to as Norplant, right? So what you put in the hand here, that's Jadel and Implanon. So that's still in tier 1, has less than 2% failure rate. And yeah, so those are the main 3 methods that are in the first tier. Okay, so and then of course, totally forgot, sterilization is in the first tier. Definitely. Sterilization is whereby either the woman has her tubes cut, that is bilateral tubal ligation, or the man has his vas deferens cut, what we call vasectomy. Okay? And then we have the second tier. It has a failure rate of 3 to 9%. So this one includes other hormonal methods, for example, the depot method. And then we have pills, whether it's progesterone only pill, what the common mwananchi knows it as mini pill. And then you have the combined oral pills, the Femiplans, etc. The Femiplans, the Yasmins, etc. And then we have other hormonal methods. Hormonal is not necessarily taken orally. So we have like what you call the Evra patch. The patches the patches that you put at the lower back. Most people use them like every month, and then you keep changing the patch. And then we have transvaginal rings that are inserted inside the vagina, and they also have combined oral contraception. So these are in the second tier. So they have a failure rate of 3 to 9%. Then the third tier has a failure rate of 10 to 20% in the first year of use, but improves as a person masters how to use them. So this includes barrier methods, that is both male and female condom, and then the safe period counting method, what we discussed in a video before, the safe window and the fertility window calculations. You can calculate using apps or using the fertility beads. Okay, then the fourth tier has a much higher failure rate of 21 to 30%. And this includes things like spermicidal gels. The gels that are advertised in most charmers, that if you apply in the vagina, that they will kill sperm. So they have a very high failure rate, okay? Okay, so I think we should now jump straight into the methods. And I will also discuss the methods that you can use when you're lactating, the methods that you can use immediately after delivery. And then, so I'll keep on mentioning these things in between, but at the end I'll do a video on lactation, and lactation is breastfeeding as a method of family planning, okay? So, let's jump into the methods that are in the first tier, the most efficient method. So I'll start with Mirena. So Mirena is an intrauterine device that is not copper. That is Mirena. Mirena is actually like a T-shaped device that is loaded with progesterone and another component called polydimethylsiloxane. But we just know that it is coated with progesterone, a progesterone called levonorgestrel. So it keeps on releasing this progesterone hormone that will be the factor that will help in family planning or as a contraception method. So it's approved for use for 5 years. Previously not well known in Kenya. People thought it was only for the very rich and people who travel abroad, but actually it's very much available, especially in Nairobi. And if you don't live in Nairobi and you work in big towns with satellite clinics or big hospitals, and you can always order. The cost is around 9,000 to 10,000. It's a very good method. It has are close to 99 or more than 99% efficiency rate. And the good thing about it is that if you have heavy menses, it also helps to reduce the quantity of bleeding. Okay, and then Mirena, then there's another one called Skylar. It's the same class as Mirena. It's a smaller one, can be used even by teenagers who have very high bleeding. I'll discuss that one time when I do adolescent gynecology. It has a bit of a less progesterone, but its efficiency is more or less the same. Okay, good. So how does Mirena work? Because of this progesterone content in it works through many ways. Yeah, Mirena is the uterus, the womb. It markedly thins the lining, so make it almost impossible for implantation. Implantation is whereby when the baby is formed for the baby to attach. And then the second way it works is that it thickens the mucus at the cervix, so making it almost impossible for sperm to penetrate. And then the third way is that it also makes movement of egg or sperm if they're able to penetrate the cervix. It makes it it impairs the motility, the movement in the tubes. So making it a little bit more difficult for sperm and egg to meet, okay? And then the fourth way it works, although very inconsistently, is that it may or may not impair ovulation. Okay, ovulation is production of egg. Then the other method that I want to talk about is the copper IUCD, copper coil, what you call coil commonly. So copper intrauterine copper device, also commonly known as Paragard. So this is a T-shaped structure that has its arms and its body coated with 380 millimeters squared of copper. It can be used for up to 10 years. Listen to this. Did you know that it can be used as an emergency contraception method with a more than 99% efficiency? Yes, so you don't need to use the P2s and the emergency pill. You can go get copper inserted within 120 hours of intercourse, and then it will last you for another 10 years. Okay, so how does it work? So it causes what we call irritation or inflammation. Inflammation is kufura, of the inner lining of the uterus, so making it deadly or lethal to sperm. So it becomes spermicidal, okay? And then in case fertilization occurs, this inflammatory process, this kufura, will make it a very hostile environment for the baby to come and attach, the blastocyst to attach. And then it is also lethal. Same way it's lethal to sperm, it's also lethal to a baby if a baby forms. Okay, so implantation won't occur, and blastocyst will most likely will not survive this environment. Okay, so that's how it works as both a long-term family planning method and also how it works as an emergency contraception method. So there are different things that you need to consider when you decide to take the copper IUD as a method. As I told you, it's more than 99% efficient. So things that I would want you to consider is first things like things that if you come to my clinic, I'll counsel you thoroughly about. Things like infection. Okay, it used to be a myth that the copper IUD will make you to have STDs, right? To have infection. So this is not true, right? It's not true. It's been ruled out as a myth. Okay. But what will cause infection if you have sexual behavior that predispose you to infection, or if you have infection at insertion, then yes, this can predispose you to infection. Okay. So as long as you're like in a monogamous relationship and you're at low risk for infections, then it's totally safe to use. Okay. So infection mostly occurs during insertion. Okay. So during insertion, if you have infection down there, so when it's been put, it's most likely going to carry infection with it up into the uterus, which can go into the tubes and cause damage. Okay, so that's why we normally sterilize and clean the cervix and also give you antibiotics immediately after insertion. And the antibiotics can be specific for the deadly organisms that are like chlamydia, gonorrhea, that can cause trouble, or can be broad spectrum, just to cover everything, including the normal vaginal flora, which when it goes up there, it can cause trouble. So infection mostly at insertion, but continuously, as long as you have low risk sexual behavior, then totally safe. Okay, that's fine. And then So if you suspect infection and you have the copper IUD, then you need to inform your doctor as soon as possible, very fast, and get treated, right? But IUCD does not cause infections. It is high-risk sexual behavior that will cause infection. Then the second thing is that people ask, can it be used in adolescents? Can it be used in girls who have never given birth, who are not married? It can be used, okay, as long as you have low-risk sexual behavior. So the myth that it can predispose to infertility in the future has been ruled out as long as somebody has good practices, okay? Although some doctors will recommend other methods other than those very invasive methods, okay? Then can it be used in HIV patients? Totally, absolutely. Who have stage 3 and stage 4 WHO staging of AIDS, which is acquired immunodeficiency syndrome, then we will not use it. But as long as you're on medication, you are well, your viral load is good, you're in WHO stage 1, 2, then it's totally safe. Totally safe. Minimal interaction with the ARVs. It's a good method. It's a very good method. Okay, so we still recommend it. And then, can it be used post-abortion or post-delivery? So if you have a miscarriage, so immediately after miscarriage, whether you have a DNC done or it's just a spontaneous miscarriage, it can be inserted. I do it a lot. So once I have patients who have come with incomplete miscarriages, and then we have to do DNCs. So immediately I finish my work, I make sure that the uterus is empty, then I normally slid in the IUCD immediately. Okay, postpartum, of course, I'll cancel my patients in clinic before delivery. So it's a good method. So once you've delivered, once the placenta is out and you're on the delivery bed, immediately I would insert the IUCD. The insertion methods, the doctors will know this, is different compared to the general population. Very nice, okay? So they can also be inserted during cesarean section. So once the baby is removed and the placenta is removed before closure of the uterus, it can be placed on the uterus. Very efficient, and the expulsion rate is not that much, okay? It's good. I think I need to address is the menstrual changes. Yes, the IUCD can cause very uncomfortable and prolonged bleeding or heavy bleeding and increased pain. So if you have pain and you have menses, it can exaggerate this pain. So if you have this, then maybe you should not consider it. But then if you have never had this and then you develop these crampings and heavy bleeding in the first few months of use, once you use what you call the NSAIDs, the non-steroidal anti-inflammatory drugs such as Brufen, then it sorts itself within like 6 months. If it doesn't see your doctor, then the other fear people have is can it come out? Can it accidentally fall out? Yes, absolutely. So it has like so expulsion is mostly within the first 1 month, whether you put it post-delivery, post-miscarriage, or interval use, okay? So that's why we normally advise our patients to always palpate for the strings. It has like strings that are left inside. So you should always palpate and see if they're available. Then go to the doctor like in a few weeks, let them examine the speculum if the strings are visible. If the strings are visible, then we're good to go, okay? So it can either come out or go up. So go up is perforate the uterus and go out. Very, very rare, like 1 in 1,000 patients. And it happens, it's usually very silent. Like you wouldn't know that it has perforated and gone up into the uterus, into the intestines, whatever, or into the muscles, the abdominal wall muscles. But very rare, like I've never seen any perforation incidents. I've never seen. It's 1 in 1,000 cases. Very rare. As long as you keep on palpating the strings, you're good to go. Okay. Then can it cause ectopic pregnancy? Can IUCD cause ectopic pregnancy? Okay. So IUCD prevents all pregnancies, whether it's uterine or ectopic pregnancy, 99% efficiency. Okay. But in the 1% chance that it fails, then the pregnancy that will result is most likely going to be an ectopic pregnancy. So this is one thing that people need to know as they embark on it as a method of family planning. Another thing that I want you to know about the IUCD is that it is non-hormonal, okay? The copper IUCD, it's non-hormonal. So return to fertility is almost always immediate. Once it's removed, once you decide that you want to get a child, so you'll go to a clinic and it's removed within 1 minute, 2 minutes. And once it's removed, The return to fertility is almost instant because it's non-hormonal. Then the other thing about it is that it's non-hormonal. So if you get affected by progesterone, if you get like body water retention, like getting fat, or if you have issues with hypertension, it's a good method. It's totally safe. It's fine, and the return to fertility is instant. That's why I'm a big champion for IUCD, especially the postpartum IUCD. So immediate delivery, if it's inserted, it will not affect breastfeeding. So that's another very good thing to know about it. Okay, so that's it. We'll talk about the other methods in subsequent videos. The next video that I'm going to do, I'm going to talk about permanent sterilization, both the BTL, bilateral tubal ligation in women, and vasectomy in men. Okay, thank you very much. God bless.